Hello, and welcome to Kines 211, Advanced Anatomy and Kinesiology of the Trunk and Core. I'm Jim Herkimer, and I'll be taking you through the course material over the next few weeks, and we're going to kind of sit down and try to expand our understanding of how the trunk and those muscles and the skeletal system and how they interact and what their function is. And I really hope by the time we're done that, like Charles Schultz says, life is like a 10-speed bicycle. Most of us have the gears we never use. Well, my goal is that we start using more gears. And we're going to take a look at things maybe a little different than what you're used to looking at things. So I'm pretty excited about this course. And we're going to get started and take a look at a little introduction this week and review some bits of information that I think will lay the foundation for what we're trying to accomplish in the weeks following. So what is the core? And I get people that come into my office all the time and ask me what the core is, or they'll say, "Oh yeah, I do a lot of core exercises. I've got great abs. I can do crunches until the cows come home." And I kind of laughed. I said, "Well, maybe we don't have quite the understanding of what your core really is if we're focusing on crunches." So I wanted to take a minute and talk a little bit about what the core is. And this slide may look a little bit familiar, and it's our center of gravity slide from 210. And one of the reasons I put our center of gravity slide back up here is one of the ways that I look at core is really how well are we able to control where our center of gravity is going. So we need to have the ability for both a gravitational component and a muscular component to control any motion that our center of gravity moves. And that's one of the ways that I kind of look at core control, is how well can I manage a superior displacement or an inferior displacement or an anterior or a posterior or a lateral displacement or any combination thereof of that center of gravity. So when I'm looking at stability, then I can really look at having stability, or having a base, is really something as simple as looking at an egg. And when I look at that egg, the shell really provides the stability to the yolk on the inside. So I can turn the egg upside down and the yolk will move directions, but it never really comes out as long as the egg shell is intact. So if I look at my egg shell, I say, okay, there's a top on it and there's a bottom on it, and there's sides that go all the way around. And that's how we have to really look at maintaining the stability of our core. So what are all the structures that are going to help to maintain that position of our yoke, or our center of gravity, in the body? And just to kind of get an idea from a structural perspective, looking at a lateral view, I can see I have some transversus abdominis muscles, I have a spine, I have some multifidus muscles, I have a sacrum, I actually have an ilium, I have a diaphragm, I have a pelvic floor. So as we go through this course, we're going to really start to identify all of the structures and the functions that really contribute to maintaining that position. And we're going to delve in pretty deep into not just the core, but we're going to look at the chest and the chest wall and thoracic and cervical spine, and look at the muscles that control those movements, and how they are integrated with shoulder motions. And when we get into the next term, the upper extremities, we'll start to see how the left hip influences the right shoulder. And we're going to we'll review how the hip motion and pelvic motion influences the lumbosacral motion. So there's a lot of things that are going to become much more integrated as we travel down this path together. But we need to review a few things, and one of the things I want to make sure we get a good understanding is just reviewing what our planes of motion are, and remembering that we move in the sagittal and the transverse and the coronal or the frontal plane, and that sagittal plane is really motion front to back, and transverse plane is our rotation motion. It's the one, it's horizontal, parallel to the floor, and our coronal plane allows us to move in a right to left or lateral direction. So those are the views, and again, probably the important component, an important thing to remember is we really don't ever move in one plane. We typically we may be one plane dominant, but we're probably moving in one or both of the other planes simultaneously. So again, looking at that motion will describe mobility in those directions. We want to make sure we understand what triplanar motion is, and that's really that motion in all three planes. And that is really a function of the influence of our muscular attachment. And this is a review of our psoas major. And we remember our psoas from lower extremity and its attachment at all five lumbar vertebrae and coursing down and attaching to the lesser trochanter of the femur. But I think what I really want to make sure we have a good mental image of here is the influence of how it comes down and spirals. And that spiraling effect is going to have both an input into the type of contraction, so it unwinds as it shortens, so it generates more force. But as it unwinds, it also creates some rotary and frontal plane components. So we think of the psoas as a hip flexor and being very sagittal plane dominant, but we look at its origin and we look at its insertion, and they are in opposite sides of the frontal plane. So we can say, okay, there's a frontal plane component, there is a rotational component, so there's a transverse plane component. So those, remembering the importance of looking at muscle attachments and looking at their anatomical positions, we have to understand the influence that has over motion. The next component is our influence of joint position. And if we just stood in anatomical position, then our muscle actions would be pretty easy to figure out. But as I change my joint position, I may actually change the function of a muscle, depending on if that axis of rotation slides to a different direction from the vector of the muscle action. Great example is we remember our piriformis muscle, right, from as an external rotator of the hip. Well, as we move into hip flexion, we get above about 90 degrees of hip flexion, it becomes an inward rotator because the axis has shifted relative to the force vector of the muscle. So influences of joint position. When we change our joint position and we are looking at what is happening in a lengthened position or in a shortened position, we have to take into account what the joint position is doing relative to the vectors of those muscle forces crossing the joint. The next is the influence of muscle length, and this is that really comes back to that concept of the optimal length tension relationship. So if I have a muscle that's too short, I won't have the opportunity to generate as much force simply because I've got cross bridges that are overlapping. If I have a muscle that is too long, then those cross bridges won't have the opportunity to hook up because they're stretched too far apart. So consequently, at about 1.2 times the resting length is where a muscle can generate the greatest amount of load. So when we look at joints that cross multiple, muscles across multiple joints, we have to take into account that a muscle can become actively insufficient or passively insufficient, or if a muscle is being lengthened at one end and shortened at the other end, we may be maintaining an optimal length tension. So looking at the length, muscle length, and understanding that at end ranges, both in the shortened and the lengthened position, will have an influence on the muscle's ability to generate force. That becomes important when we're looking at developing stability and developing function in the trunk. Now, the thing we didn't spend much time on last time, and I want to kind of review from physiology, is the influence of muscles and joints by proprioceptors. And a proprioceptor is just a sensoreceptor that's found chiefly in muscles, in tendons and joints in the inner ear that detects the motion or position of our body. So we're going to kind of take a look at a few of these proprioceptors so that we can have a better understanding of what their role is in stabilization and movement patterns. So the first one we kind of want to take a look at is the muscle spindle. And the muscle spindle is responsible for our stretch reflex. And when we look at in my picture of my skeleton bending forward here and lengthening his hamstrings, we can see that there is a structure contained in the extrafusal fibers called the muscle spindle. And it becomes stimulated when it's lengthened. We're going to look a little closer at this in the next slide. So when it's stimulated, it runs a quick short arc reflex through the spinal cord, never makes it up to the brain. So it's a sensory input from the muscle spindle to the spine with a connection to a motor neuron back to the extrafusal fibers, causing them to contract. So I have the ability to cause increased tone or a muscular contraction in a muscle when it's being stretched. So let's take a little closer look at that, how that might work. And here's my picture of a muscle spindle. And it really is made up of primarily two different types of receptors. The nuclear bag is the top is my top receptor, and the nuclear bag is responsible for dynamic change and quick change in muscle length. So when the muscle is quickly stretched, okay, that bag deforms, the nerve is stimulated along this 1A afferent nerve, turns around and comes back to a extrafusal efferent motor nerve, telling the muscle to contract. So the best example that I can use for a stimulation of the nuclear bag is when we do a patellar tendon reflex. If somebody's sitting off the edge of a table and with a reflex hammer you tap their patellar tendon and their knee extends. That's a perfect example of a quick stretch on the rectus femoris, resulting in a deformation of the nuclear bag, quick reflex to the spinal column, stimulating the extrafusal fibers, the muscle fibers themselves, causing a quick contraction, and the knee extends slightly. The other type of receptor within the muscle spindle is this nuclear chain, and that's my lower example here. And we can see that the nuclei are arranged in series along this nuclear chain. This receptor is responsible for static stretch. So as the the tension within the muscle changes as we slowly stretch the muscle. The excitability of the change in the position of these nuclei stimulate the 1A afferent and slowly increase the tone of the extrafusal fibers. So this is when you have somebody and you want to lay them down and do a static stretch, and as you increase the stretch and you feel the tone, the tightness within the muscle increase, what you're really doing is you're stimulating the nuclear chain and increasing the tone, which is a protective mechanism so that you can maintain the position. Now, why is this important? Well, yeah, it's a protective mechanism, but the important component to this is really that our bodies will use muscle spindles in preparation for movement. So that load and explode concept, where we may drop down to lengthen a muscle while it's contracting, that eccentric load stimulates the muscle spindles so that the extrafusal fibers, the muscle fibers themselves, can generate a better, stronger, more efficient contraction. Now there's another component here that looks at a stimulation from the efferents, and these are small motor fibers that come down and attach to an intrafusal fiber. This is a small muscle fiber that is able to contract within the muscle itself. So it's an intrafusal muscle fiber, and when it contracts, it can stimulate the nuclear bag and the nuclear chain the same way that a stretch can do it, which would mean that the muscle spindle has the ability to self-regulate and increase both the tone or a contraction within the extrafusal fiber. So muscle spindles really, really important at helping to maintain, modulate, and improve our muscle function and our ability to generate normal motion patterns. And one of the things that I really look at as a therapist, when I have people come in with abnormal movement patterns, I really want to look at how effective is their motor system at utilizing their muscle spindles and utilizing that load and explode concept of loading the muscle and coming out of that loaded position. Now, in opposition to the muscle spindle, the other protective mechanism is this Golgi tendon organ. And Golgi tendon organs are receptors that hang out in the tendons, and they're responsible for measuring tension within the muscle. So as the muscle increases its tone or increases its contraction, we stimulate the receptor within the tendon. That receptor then runs along a sensory neuron, again, just to the spinal cord level, and splits. One side is an inhibitory interneuron, and one side is an excitatory interneuron. So within the inhibitory neuron, we have an effector, which then comes back and decreases the tone in the muscle where it is experiencing tension. So as I generate a stronger quad contraction, I will stimulate as a function of the tension. I will stimulate the Golgi tendon, and the more I stimulate the Golgi tendon, the more I inhibit quad function. And again, why does it do that? It does that simply to protect the tendon. It's a protective mechanism so that we don't generate so much force that we tear the tendon. And in fact, we also, on the excitatory interneuron side, we will stimulate the antagonists. Now, The reality is, with the Golgi tendon organs and their relationship with the muscle spindles, is they are also responsible for smoothing the motion and integrating motion. So one of the things that you'll see is somebody starts an exercise program and they get significantly stronger in a very short period of time, 1, 2, 3 weeks, and all of a sudden they're significantly stronger, especially somebody that hasn't been exercising. What we've really done is we've started to do a much better job at teaching the Golgi tendon organ to monitor the tension within the tendon better, and to realize that we can get stronger. We don't have to be quite so sensitive to that tension, and decrease the amount of inhibition that's occurring as a direct result of the tension. So when we hear this idea of strength gains initially as a function of an improved nervous system, one of the many components that contribute to that is this effect of the dampening, so to speak, of our Golgi tendon organs. But again, when we come back and we look at normal movement patterns, what's the influence of the muscle spindle? What's the influence of the Golgi tendon on normal muscle function? Last couple of additional receptors that we need to kind of get an idea about what they do is primarily just two that we want to take a peek at, and they're the Pacinian corpuscles and the Ruffini endings. So let's talk about the Pacinian corpuscles first, and they're found just beneath the skin, and they're concentrated in regions that are around the joint capsules and around the ligaments and around the tendon sheaths. They're kind of large organs, and the tip of the nerve fiber is surrounded by a bunch of concentric layers of a capsule. They are activated by a rapid change in joint angle, and they're activated by the pressure that compresses and distorts the capsule, but they're only active for a very brief period of time. So they are important for detecting rapid changes in pressure, but useless for constant pressure awareness. So an example would be in running, the information provided by the Pacinian corpuscles allow the nervous system to predict where the feet will be at any point in time, and so appropriate adjustments in limb position can be anticipated and can be affected as needed. Now the Ruffini endings are also activated by mechanical deformation, but in contrast to the Pacinian corpuscles, they're important for signaling continuous states of pressure. So they adapt slowly, but then they transmit a steady signal thereafter. So Ruffini endings are located in the deep layers of the skin. They're scattered throughout the collagenous fibers in the joint capsules, and they're stimulated strongly by sudden joint movements. So they're really important in sensing joint position and changes in joint angle by as little as 2 degrees. Each of these joint receptors monitors a specific section in the total range of the motion of the joint. So I always use the analogy of if you put your hand behind your back, you can't see your hand behind your back, but you know it's there. And the reason that you know it's there is the Ruffini endings are telling you that they're telling your brain where your shoulder, elbow, and hand are. We also want to spend a second talking a little bit about fascia. And when we look at core stability and the trunk, we really have to continue to improve our understanding of the function of fascia. And we'll look at this at much greater length, and especially as we start looking at the function of the muscles that are contained within the lumbar spine, really enveloped by the thoracolumbar fascia. But the functions of fascia are, they envelop and isolate muscles. They create compartments to assist in greater muscular force production, and we'll really see how that functions when we look at how the multifidi are contained within the thoracolumbar fascia. Provides structural support, and it provides a pathway to guide forces through the body. So we start to see this dissipation and transmission of forces that create multiple support segments throughout the body. So that's really what I wanted to start with in looking at the introduction to our first course. And what I want you to look at is get a better understanding of the proprioceptors, which means you're going to need to look back into your physiology book from your physiology class. Get a better understanding. Start to understand and appreciate different lengths, different positions that may impact and stimulate those receptors. Start to get a good understanding and review planes of motion, review length tension relationships, and understand how they're going to work together. Because now we really start to get to see the integration of the foundation of movement with what we learned in lower extremity. So take a look at that, and we will continue to move forward and look at next week. Look at how the lumbar spine anatomically is and the movement patterns associated with the lumbar spine. So looking forward to that.